Welcome to Nexus Medical Media. If this is your first time, please make sure you subscribe so that you won't miss any of my latest videos. In this video, we are going to talk about skin grafts, right? So what is skin grafting? This is transfer of skin from one area, we call that a donor area, to the required defective area. We call that a recipient area. And a skin graft, as I said in the previous video, is an example of an autograft, right? So how do we classify skin grafts? Skin grafts can be classified into partial thickness graft or split thickness skin graft, SSG, also known as Teich graft. And we also have a full thickness graft or Wolf graft. So these two are very important, and the rest of this video will be focusing on the partial thickness. In split thickness graft, there is epidermis plus only part of the dermis. In full thickness, we have epidermis plus full dermis. So partial is part of, we're just referring to the dermis here. In both of them, we have the epidermis, right? So partial thickness, part of the dermis. Full thickness, full dermis. Right, so let's continue with the partial thickness grafts. Right, so this is very important because most of the grafts you see being performed are actually split thickness grafts. Right, so what are the indications? Burns. Severe burns that have destroyed the skin layer often require grafting to cover the wounds, to promote healing, and to prevent infection. Chronic wounds. Non-healing ulcers, such as those seen in diabetic patients, may benefit from grafting to promote healing and restore skin integrity. Traumatic injuries. Large skin loss due to trauma or accidents can be addressed by skin grafts to cover exposed tissues and improve the functional outcomes. Congenital abnormalities. Some congenital abnormalities that affect skin integrity may be managed with skin grafts to improve appearance and function. And surgical defects. This is after surgery to cover and close the defect created. For example, after a wide excision of malignancy, after mastectomy, after a wide excision in squamous cell carcinoma. This is just a point that you will find useful later. Grafts can survive over the periosteum, paratenon, and perichondrium. You understand what I'm trying to say here. Let's talk about the pre-operative evaluation of the patient. First, any patient, you start with the history and examination. So in medical history, you need detailed patient history, including of any chronic diseases, for example, diabetes, hypertension, any previous surgeries, or history of poor wound healing. In physical examination, you need assessment of the recipient site for adequate vascularity and potential for healing, and evaluation of donor site for suitable skin quality. And here in this examination, you need to see granulation tissue, a proper granulation tissue. In some texts, they will say this is actually an indication that it's time for a graft. Now, you do laboratory investigations, including full blood counts, blood glucose levels, coagulation profiles, depending on the condition that the patient may have, the underlying condition. And in imaging, you need chest X-ray. And in some cases, you may need Doppler studies. For example, if someone has that chronic limb ischemia that result in an ulcer, you definitely need a Doppler studies. Right? But in any patient, if you get asked how do you prepare a patient for theater, you need to know those laboratory investigations. Full blood count, U&E, you need to know of chest X-ray, and you need informed consent. Right? So it's here. Patient counseling. So you need to educate the patient about the procedure, where you are going to take the part of skin, the potential risks and expected outcomes, and you have to inform you get informed consent. For example, in a split thickness graft, this is going to be different. I mean, in terms, if the area is going to be different from the rest of the skin, and there won't be production of a sweat, just an example. So the patient will have to make adjustments like putting coconut oil, preventing cracks, etc. Right. So what are the contraindications of a split thickness graft? So these are the conditions that may contraindicate a skin graft or may require modification prior to a surgical approach. These are the contraindications. Contraindications usually are classified into relative and absolute. Active infection. Presence of an active infection in the recipient or donor site can compromise graft success and should be treated prior to surgery. Absolute, so infection just in general, being it any bug, is a relative but absolute contraindication if there is beta hemolytic streptococci load of more than 10 to the power of 5 per gram of the tissue. This is an absolute contraindication. This is the other absolute contraindication. It can not be done over the bone, the tendon, and cartilage. Uncontrolled systemic diseases. For example, if someone has uncontrolled diabetes or severe cardiovascular disease, which may increase the surgical risk, you may need to modify this. You need to restabilize this patient. Poor general health. Patients with significant comorbidities or poor overall health may not be ideal candidates for surgery. Inadequate blood supply. If there is poor vascularization of the recipient site, this can lead to graft failure and may necessitate alternative strategies, right? So, if the patient says, no, I don't want a graft, probably that's another absolute contraindication, and these two and the other ones in general are relative. So, technique from the donor area. So, the donor area, usually the thigh. You can also take a graft from the arm and the leg, also the forearm. The instruments used are the following: the Hamby knife, the Watson modification of Hamby's knife. There is power dermatome. Sterilized razor blade can be used with a specialized device to harvest small grafts under local anesthesia, right? And this donor area is dressed, and we don't open it until 10 to 14 days, right? Don't open it earlier. 10 to 14 days, that's when you open the donor area. And how does it heal? It heals by re-epithelialization. Re-epithelialization. That's about the donor area. The recipient area, right? So you need to scrape the area well, and the graft is placed after making window cuts in the graft to prevent development of a seroma. The graft is fixed, and a tie-over dressing is placed. Sometimes you actually put a mesh, right? So a mesh is very important. It actually increases the size or the surface area you can actually cover 6 times more, right? A graft is if a graft is placed near the joint, then the part is immobilized to prevent friction and may separate the graft. This is the mesh I was talking about. And the recipient area, when do we open this? 3 to 5 days. After 3 to 5 days. And you, in this case, what are you looking for? You are observing for the graft take up. How does it heal? There are stages of a graft healing. So if you click the link on the top right corner, we have a small video. We just talked about the stages of graft uptake. So just click there and watch that video, or just wait. After the end of this video, you will see another link in the video description and watch that video. Post-operative care. right? So this is critical for the success of skin graft surgery, and it includes the following: wound care. So regular dressing changes and monitoring for signs of infection or graft failure. In pain management, use of analgesics to manage post-operative pain, monitoring for complications, regular follow-up appointments to assess graft integration and monitor for complications such as infection or rejection. Activity restrictions, advising patients on activity limitations to avoid stress on the grafted area. Complications of a split thickness graft, right? So graft failure. Graft failure is when the graft fails to integrate with the recipient site, which can result in loss of the grafted tissue. And this could be caused by a seroma or hematoma. Infection, potential for wound infection, which can compromise the healing process. Rejection, the recipient's body may reject the graft, particularly in cases of allografts. That's foreign, of course. Scarring, scar formation of a hypertrophic scar or keloid at a donor or recipient site. Donor site morbidity, there is pain, discomfort, and cosmetic issues at the donor site. Thank you so much. If you enjoyed this video, please make sure you subscribe so that you won't miss any of my latest videos. Until next time.